There we go. Still learning my way around this new system here. Apologize for that, and I forgot to turn my thing on. Yeah, actually, literally, there's a button to press to unmute myself. This is like like every Zoom meeting you've ever been in. Hey, you're muted. Okay, so and I'm glad it was that easy to fix it. So as I was saying, and you didn't hear, the news today on the coronavirus is a bit of a mixed bag. There's bad news and news that doesn't sound quite so bad. It isn't quite so bad, but nothing like good news on coronavirus. So here's what we know today. This kind of the headline today is hospitalizations. This is the bad news. You remember hospitalizations went down over the weekend, like Friday and Saturday, Thursday, Friday, Saturday, and it went down just a little bit. And then Sunday went back up a little bit, but not bad. And today it took a big jump upward, and we're now in record territory again. We have 2,274 people currently hospitalized with coronavirus infection. That's 178 more than yesterday. That's the biggest jump we've had in a while. And that's, to give you an idea, that's 271 more than a week ago. So the fact that the 1 day jump, like most of the increase over the past week has taken place just in this yesterday, just in this last 24 hours. So that's not great. Now, hospital capacities are holding up for the time being. Statewide ICUs are at about 88.5% capacity, which is roughly the same as it was yesterday. Which means, we've had 11 more ICU patients today. The ICU population didn't go up quite as steeply as the general population. So we have 456 people in ICU right now. But ICUs sort of statewide, it varied a little bit by region, but statewide, the ICU capacity stayed roughly the same, which means that they had 11 people go into the ICU and at least 11 other people come out who may or may not have been COVID patients, right? The capacity has nothing to do with who or what kind of ailment the ICU is available for. It's just that here's an available bed and room and staff in an intensive care unit. And I think many hospitals are being very intentional right now about limiting their use of ICUs for non-COVID patients. They're like postponing elective surgeries and stuff like that. So for right now, the hospital capacities are okay. The alternative care facility in Milwaukee actually went down by 1. It is now 19. So that's holding up okay. When we're talking about hospital capacity, we're talking about statewide. Dane County did go up a little bit, but not quite as steeply as the state did. Yeah, Halloween was almost 2 weeks ago now. We're not seeing a big spike yet from that, but that might be because of lower testing. That's a good segue to the actual numbers today. The infection numbers today are lower, but we expect that on a Monday, right? Because they're just not processing as many tests on Saturdays and Sundays. So we have just over 12,000 tests today, which, that was the goal at one point. The goal was, back in the day, back in April and May, we were doing 1,500 tests a day. And the goal was to get to 12,000. And we all thought that was crazy. Now 12,300 is what was reported today. That's like really low, which is good. That's a good place to be. We are testing a lot. We could be testing more. But yesterday we had 18,000. Saturday we had 19,000. Friday we had 18,500. Thursday we had 22,000 tests. So to be down to 12,000 tests, not great. But part of the effect of lower testing is fewer positive cases. So we have 4,389 tests positive results today, which that's the lowest since last Monday. Last Monday we were at 4,360. So to be at 4,389 today, right in line with last Monday. So I will also mention that last Monday we had 14,000 tests. So again, lower testing means lower positive results. So, it's nice not to break a record again. But, last Monday we had a low number, 4,360, and we broke the record 3 times over the next 4 days. So, the fact that this Monday is not tremendously higher than last Monday, maybe that means this whole week will be, kind of in line with the previous week. We'll see. If we're going to see a spike from Halloween, we'll probably start to see that tomorrow as more tests are processed tomorrow, Wednesday. So, we'll kind of cross our fingers and hope for the best on that. Paige asks on Twitter, that's a higher percentage, right? It is a pretty equivalent percentage, actually. Yesterday with 6,058 positive tests out of about 18,000. That's about a 33% positive rate, which I will add feels normal to us, but is ridiculously high. Just to put that out there. Today, both the number of tests and the number of new cases came down at a pretty similar rate. So the positive test rate today is 35.7%, slightly higher than yesterday, not a lot higher. The more important measure is really the 7-day average of positive. So you want to look at it because any particular day could be an outlier. You could just have a bad day or a good day. Or sometimes we don't get all the negative tests reported at the same time. We're supposed to now. They're much better about that now. But just in case, we like to look at the 7-day. And the 7 days, 36.4, which again is very high. It's been really steady at that for about 5 days now, between 36.2 and 36.5. So not a meaningful difference over the past 5 days, which is good. It's bad that it's so high, but it's good that it's not going higher. To give you an idea of how high that is, I talk with other local journalists around the country, every day. Really, we have a pretty good network of people across the country doing this work, and I mentioned in a Facebook group yesterday that So we're about, we're pushing 37%, and the response is universally, wait, what? Like, just shock that Wisconsin is at 37%. I will say that's the number of people who tested positive. The number of tests that came back positive is 17.9%. There are actually a lot more tests than there are people tested, because there's a pretty significant population now that's getting tested multiple times a week. Okay, so the percentage of tests that come out positive is 17.9. That's still really, really high. Those should be like 1 and 3. Okay. I'm Genesis. She's been tested on Thursday and still hasn't heard. The last time I got tested over there, it was a while ago. It was in June, and it took about 3 days. And I know there was a lot of traffic there late last week. So I would not panic yet. That does seem a little slow, but don't panic yet. Aaron asked you to do a second look if it shows positive. You're saying if it's positive, it might take it might take a little longer to hear back if it's positive. I don't think they do a second look at the same sample. I don't think you can do that. I think you run that sample and that's it. They might do another confirmatory test, but they'd have to call you to bring you back in to test you. My sense is that they actually want to get positive results identified earlier, so that they would call you. Basically, right now what they're doing, is if you're positive, they call you, and if you're negative, they email you. So if you I would tend to think if you haven't heard in 3 days, that probably means you're negative. But I wouldn't, I would give them a call, honestly. Maybe wait till the end of today, or maybe like noon tomorrow, and see what they say. Yeah, it is. Yeah, it is. It's supposed to be faster if it's positive. Doesn't mean it always works that way. They're doing a lot of tests, you guys, and unfortunately, a lot of positive results. Okay, a couple other numbers for you, and then I want to talk through the timeline. It was just because we've got the time here. We'll just some interesting things to note over the last several months since they're back in court again today. The total number of cases now that we've ever had is 316,758. More than 70,000 of those are considered active. If you listened to the podcast this morning, you'll note that I predicted that, and I was right. And I'm going to mention that to Stephanie tonight when she gets home. We were at 69,000 yesterday. I said I wouldn't be surprised at all if we had 70,000 active cases this afternoon, and we do. So about 22% of our total cases we've ever had are currently active. That's about 1,500 more cases than yesterday, but that 22% has been pretty consistent for the past couple of weeks. 7-day average of new cases is down a little bit because our Monday number is low. So we're at 6,319 total cases today. 7-day average of deaths also went down a little bit to 45.71, which still feels awfully high to me. But again, we had 12 deaths reported today. Again, that's a lowish number because there's just a lot of paperwork that goes into reporting that each death. So we just don't get as many on Sundays and Mondays. Last week, we had a couple of days where it was like 11 and then 17, and then the next day was 66. It's just, you kind of never know. So we've had 2 days now in a row of 12 deaths. So, I would anticipate tomorrow being a much higher number. Hope it's not, but that's been the pattern. You had a couple of days of low on the weekend, and then you back up to the 50s and 60s. I would expect it to be, I would expect that average to creep up toward 60 in the next couple of weeks. Just based on the math, based on the ratios, unfortunately. Okay. The deaths today, again, there's only 12 to report, so that we only have 6 counties, but 4 of those deaths are in Waupaca County. So 4 out of the 12 were Waupaca County. Chippewa County reported 3, Eau Claire County reported 2, and then there were 1 each in Lincoln, Kenosha, and Jackson. So there's one, you might remember yesterday, there was actually 1 death taken out of the data in Lincoln County. Every once in a while, like, they'll classify death as a coronavirus death, and then they'll have to, oh, we didn't mean to confirm that, or we have to run one more test to confirm it or whatever. So they take it out. And now there's one more back in Lincoln County. So it might be that the person that took out actually died of something else. And now there's another person who died that was COVID, or it could be that same person who was confirmed with COVID. Then there was a question, so they took him out, and then they put him back in today as they reconfirmed it or something like that. Again, either way, it's a human life. It's a person. It's somebody's grandma or son or husband or wife. So we hate to talk about like numbers like that, but that's just the way these numbers kind of work. There's always a little bit of shifting here and there, one or two. But those corrections in the data make you know that it's real. That people are really trying really hard to report this accurately, so that we have all the best information, and then we do our very best to get that information to you. In terms of cases today, pretty spread out, honestly. The most new cases in any particular county is 567 in Milwaukee County, then 503 in Dane County. The University of Wisconsin is creeping back up. There were at nearly 100 cases on campus yesterday. So, I don't know what they're going to do there. And then third is 284 in Eau Claire County. So it drops off pretty quickly after Milwaukee and Dane. But in terms of per capita, Eau Claire is number 1. 284 cases there translates to 267 new cases per 100,000 residents, which is kind of the per capita measure. There's a chart of this that you can, on the website, on the Madison365.org, if you click the main story about COVID today, at the bottom, you got the spreadsheet, and you can actually arrange it by county or by new cases or new cases per 100,000 or deaths. So you can kind of get a sense of these numbers. But the top counties, other than Eau Claire, which Eau Claire is a pretty rural county, but Eau Claire itself is a decent sized city. But after Eau Claire County, you have Juneau, Polk, Trempealeau, Rusk, Barron, Dunn, Jackson, Taylor, before you get to La Crosse. And those counties are all very rural, and they're at the top of the number of cases per 100,000 residents. 193 in Juneau County, 184 in Polk, 179 in Trempealeau. You know what I mean? So what we're trying to do is give you a sense as to, even though a rural county maybe doesn't have a lot of cases, it's a lot of cases for the population of that county, right? I hope that makes sense. Okay, one other thing I want to just kind of note here, I want to use the screen sharing feature of my new thing here. But if you go to Madison365.org/COVID-19, we've got basically all of our COVID stats on that page. Or not stats, but all the COVID stories, all the news about COVID on that one page. And on top of that page, I've got this chart now that I made. And this is, pretty typical looking chart of COVID in the United States, right? But I just want to note a couple of dates on here. So right here, at this little peak right here, is the day we closed schools. March 13th, our positive test rate was 6.51. The blue line here is the positive test rate. The yellow numbers here are the number of new cases confirmed. And you can see here, as we get this spike here, you can see the difference between the weekdays and the weekends, right? So 13th, we closed schools. Things are going up and up and up. The 25th, the governor orders safer at home. Things continue to rise for a few days after that, because we know there's a lag in this disease. But then things level off, and then things start to come down, and this is good, and everybody's happy, and things are going well. And then the Supreme Court overturned the safer at home order right here. And then things continued okay, because I think people had kind of gotten into the habit of, doing well and being good. And then we start to it's summer and we start to get complacent a little bit, and we start to break records here again in July, and then school starts, and you get kids back on campus at the EW schools, and then all hell breaks loose. Now today, it was, in October. I don't remember the dates exactly. I'm sorry, because they're not relevant. Because the governor put a new restriction in place for bars and restaurants and retail, and that was thrown out by the court. And then there was a mask mandate also issued in here somewhere that was in court today. So we will see what that does. And my own feeling is that the outcome of that case is kind of irrelevant, because if the Supreme Court allows it to stay, nobody's going to enforce it anyway. Like, it's just not being enforced outside of Milwaukee and Madison, I don't think. I mean, a lot of people are choosing to wear their masks in compliance with that order. But if the order is struck down, those folks will wear their masks anyway, right? And if the order is upheld, people who aren't wearing masks will continue to not wear masks and will continue to face no consequences, because law enforcement is not enforcing the mask mandate anyway. So, I'm not optimistic that court case is relevant at all. Right? So that's just my thought on that. One other note, I want to make a statistical note that I don't know anything about. I have asked Public Health Madison Dane County. This is, again, specific to Dane County. But yesterday, Dane County had about 360 new cases. Today, we had almost 500. And each day, more than 20% of the new cases were Hispanic or Latino. That concerns me a lot. In Dane County, Hispanic and Latino people make up only about 6% of the state's the county population. And it's always been a little bit disproportionate, and Hispanic and Latino people have made up a disproportionate percentage of those who are hospitalized and of cases. But it's been better recently. It's been more close. It's been like, they make up 6% of the population and like 10 or 12% of the cases. But the last 2 days, it's been 20% of cases each day. And so I did shoot an email to Public Health Madison Dane County. It might be that there's a specific population that's being targeted with testing. If you find an outbreak in a workplace and you are really, intensely testing people who work there, you're likely going to have more cases from that, because you know that that's kind of an outbreak. So I don't know if there's like that kind of outbreak happening in Dane County right now, or what, but I'm going to try to find out, because it's really concerning that you have that level of disproportionality among a specific ethnic group, and I don't like that. So I'm going to try to figure out what that's about. And in the meantime, I have a little bit of fundraising news for you. I know a lot of you value this update every day, and you value Madison365, and you value the podcasts. And right now, if you translate that value into a donation, your donation can be doubled. It will be doubled, because if you give us $10, the Knight Foundation and Democracy Fund and Facebook Journalism Project have put together a pot of money to give us another 10. It's called News Match. This is this program. It goes from November 1st to the end of the year. We're a 501c3 nonprofit news organization. We're in good standing. This is not just any news organization gets to do this. You have to be like approved, and you have to make sure that you're a really legitimate, independent, nonprofit newsroom. And if you are, and people make donations, we tell them how much you donated, and they cut us a check for that amount. No questions asked. That's all there is to it. We just found out that they'll match up to $11,000 of donations. And we just found out today that the DEI fund, I assume that means Diversion, Equity, Inclusion Fund, we didn't even ask for this, but they just reached out through the Miami Foundation, which is the sort of oversees this whole program. And they will match us another $7,000 if we raise $7,000 from you all. Now, so far in the course of November, I didn't do a check today, but I think we're, in the $4,000 range so far for the month, which is great. Really appreciate all that. Can't tell you how much we appreciate that. But if we can, muster up another 3,000 by the end of the year, we can basically, that's for 7,000 gets tripled. Does that make sense? So it could, if we make 7,000, if we make it to 7,000, we'd actually end up with $21,000, which goes a long way in our budget. Our budget's pretty tight. If I could swivel this camera right now, you could see my studio is like a 10 square foot corner of my attic, right? We don't have an office. We don't have a lot of equipment. We buy our press oil press badges. We get it FedEx for $1 each. We have our notebooks we buy at Amazon in bulk, so they're cheap. All of our, most of our budget, almost all, goes to paying our reporters to do professional journalism, to keep you informed. That's where the money goes. That and to producing our events like the Wisconsin Leadership Summit and the racial justice town halls we had over the summer, but those are mostly sponsored, so that doesn't cut into our overhead either. So when you make a donation, really what you're doing is you're funding our young professional reporters. And if you, as a group, can get us to $7,000 over the next couple of months, that will magically become $21,000, which goes a long way. That's a lot of stories to be written for $21,000. So if you go to Madison365.org/donate, make a donation now. We'd really appreciate it. It would really help us out, and your money is tripled, basically, if we can get to that $7,000 goal. And I'll keep you updated as to how we're doing on that goal. But thank you, Jenna. I don't know if you can hear the blood curdling screams outside. That is my daughter, I think, having a little bit too much fun. But yes, do buy local, and do we never charge you for the news. That's kind of defeats the purpose for us. We want to make the news and the information available to everybody, not just those who can afford it. So what that means is those of you who can afford it, maybe pitch us a few dollars and help out. It's a tax deductible donation. It's very easy to do. Just go to Madison365.org/donate and tell your friends. So, not seeing any other questions right now. So we will have, more news in the morning. We'll have a report from the Urban Triage grand opening over the weekend, which is a nonprofit here in Madison that's doing a lot of great work in the Black community and with the movement for Black Lives. They just opened their first ever real live headquarters, office, whatever. So they opened that on Sunday, and our reporter Naomi Wolf was there, so we should have that report tomorrow morning, both on the podcast and on the website. And we'll have, more news on coronavirus, more news on communities of color in Wisconsin, as always. So we appreciate your support and your attention today. Feel free to shoot us an email, news@madison365.org, if you have any requests, any stories you think need to get covered. Jenna asks, and I put a link to the donation thing. I'm going to try this. Yeah, it looks like I got the link on Facebook, YouTube, and Periscope all. Cool. I'm really enjoying my new video thing here. Thank you so much again. And stay well, stay safe, take care of each other. And we will see you again tomorrow. Now I got to figure out how to turn this off.
This is 365 Media.